I had polio in 1950 when I was 4, the acute polio. Really was aware of developing post-polio symptoms in about 1985. I started having a few more problems, and but also there started being some stuff in the media initially in about the mid-'80s that there might indeed be such a thing. Prior to that, polio survivors who'd been noticing increasing fatigue, increasing weakness, were just told they were getting old. But some of them that were only in their 40s said, you know, I'm really not that old. Post-polio syndrome, there isn't a diagnostic test per se, so it's what we call a diagnosis of exclusion. People may have one of the following 3 symptoms: increasing weakness, which then results in decreasing function, musculoskeletal pain, and people who were old enough to remember when their acute polio say it feels a lot like the acute polio, mostly really achy, you know, like sort of overuse kind of things, and unexplained fatigue. People will say they suddenly get to a point that at 2 or 3 in the afternoon it feels like they hit the wall and just can't take one more step or do anything without stopping to rest. It happens in about 40 to 50% of polio survivors, and happens 20 to 50 years after the onset of the acute polio. Usually has a fairly insidious onset, although it can have a fairly acute onset if people have had a major stressor, either psychologically or physically. I tell people it's like, as you're starting to need bifocals, you know, you keep adapting and adapting until finally one day you say, oh, I've got to get bifocals, but it's just because your arms aren't long enough anymore. There isn't a curative treatment. So I tell people, having grown up in South Dakota, that it's like keeping the old combine or the old pickup going another season or 2 with bubble gum, baling wire, duct tape. There are a lot of advances in bracing. There's, you know, and certainly now, powered mobility equipment, scooters, wheelchairs are better and the world's more accessible. So there are a lot of things people can do to still be living a full life. You know, the good news is that the polio vaccine was so effective that they don't see it, and they have a small number of patients who have polio-related problems. The bad news is that for the polio survivors that are still here, trying to find somebody who, it's hard to find a physician now who knows how to prescribe a brace. When there were 20,000 cases a year or 50,000 cases a year, as a public health issue, we said 8 or 10 cases is acceptable when we're preventing, you know, 19 or 49,000 cases. When polio was so effectively eliminated with the vaccine, we said, no, 8 or 10 a year is not acceptable. So in the United States, we're back to using the killed vaccine, the shots, the Salk vaccine. In other parts of the world, they're still using the oral vaccine because it's much easier. It doesn't take trained personnel to administer it.